Hi, I'm Dr. Sharmila Changkakoti. I'm a consultant neurologist working for the Zahra hospitals. I get to see a wide variety of neurological disorders, migraine, some other varieties of headaches, back pains, people coming with weakness and numbness of the legs, hands. Well, stroke is a sudden onset neurological disorder which occurs due to an interruption in the blood supply to a part of the brain. It is one of the commonest neurological disorders. In fact, it is the third leading cause of death in the world and the commonest cause of disability. The brain is supplied by blood and the nerve cells of the brain require blood supply continuously, and if there is any reason for interruption of blood supply to the brain, there are different symptoms and presentations of a person, and that is what we call stroke or a sudden brain attack. The symptoms of a stroke depends on the part of the brain where the blood supply is interrupted. It could be because of an occlusion of a blood supply of the artery which is supplying the brain, or it could be because of a hemorrhage or a leakage of blood into that part of the brain, a weakness or numbness of a part of the body, sudden inability to speak or slurring of speech, sudden loss of vision, sudden onset numbness, sudden severe headache or loss of consciousness. There are some risk factors which make us prone to a sudden occlusion of a blood vessel or interruption of blood supply. We need to have a healthy lifestyle to prevent these risk factors. Number one could be maintaining ideal body weight, avoiding obesity, maintaining ideal blood pressure, controlling blood sugar levels. These are what we call controlling risk factors or primary prevention of stroke. Avoiding smoking, avoiding excessive use of alcohol, any other medical conditions which would make one prone to stroke has to be controlled on a day-to-day basis. Most important thing would be one should rush to an emergency unit with a facility for managing stroke immediately. The word that is to be conveyed to everyone is time is brain, because now we have some medicines available which given immediately busts the clot in the brain and can help you to recover from a stroke very fast. Well, migraine is nothing but a headache. Usually it's a throbbing headache on the forehead which radiates towards the eyes. Usually there is associated sensitivity towards light and sound and nausea, and it lasts a minimum of 4 hours to even it may last up to 2 days. The number one thing would be to identify your trigger. What triggers a migraine attack in you? And try the very best to avoid those triggers, which could be excessive bright light, which could be excessive extremes of temperature, which could be avoiding irregular meals, fasting, and avoiding irregularities in your lifestyle. I have seen patients getting headaches or migraines because of lack of sleep, and I even get patients who complain of headaches on a Friday or on a holiday because they sleep late, they get up late. So any change in your daily schedule could trigger a migraine. Management of migraine is number one would be avoiding the triggers. The second thing would be to take pain relieving medication, which we call them as the triptans, which are given for acute headaches. Now there are two types of medication. One is the preventative medication and the other is the medication for acute management of pain or medications for acute headache. If a person has very frequent headaches or the number of headaches are 3 to 4 severe disabling headaches in a month, we suggest preventative medication in them. And the other would be to keep the medications for the acute headaches, which could be right from the normal painkillers like paracetamol or brufen, right up to the other variety, as I said, the triptans, which have to be taken under supervision of doctors. The long-term plan would be to avoid those triggers, and if they are very severe, disabling, very frequent in a person, to take the preventative medications. And the last thing now we have available is, and I have tried them in a couple of patients who suffer from chronic migraine, and they seem to continue to have the headaches in spite of the preventative medications, is botulinum toxin injections given on the scalp.